Hello everybody, this is Gültekin from Türkiye. Let me find my... okay. Hello again, this is Gültekin from Türkiye. I was working for Ankara University Faculty of Veterinary Medicine, Department of Microbiology as a postdoc, but I recently started to work for WHO Country Office for Türkiye as a National Professional Officer for laboratories. So today I will talk about some of the works that has been done by us in the phage, Bioinformatics Pipelines and Data Visualization Working Group. So I know it's a bit late. It's 4 p.m. and I don't want to burden you with like a lot of information, okay? So I would like to start with empathy. So I want you to ruminate this word throughout my talk, okay? So why I'm talking about empathy? Because let me give you my example about this. So I was interested in bioinformatics all the time, and there were not many people around me to help me on this idea. And I always look for others to share and discuss the things about the bioinformatics with me. I was struggling a lot because in Turkey we can't find a lot of people dealing with, especially with the microbial genomic stuff. So I was thinking that there might be some people around the world that I can discuss and find solutions about the problems that I'm having. So I looked internet, I checked everything, and I found phage. It was around 2020, I think. And I saw that we need to know always there's someone else having almost the same problems as you're having and the same challenges towards. So, as I said, empathy helped me to find phage and enter phage as a member. So, which connected me with the people that feeling the same with me, feeling the same way as me. So in the working group, on the other hand, we are focusing mostly on the lived experiences and real needs. We are not trying to discover the USA again. This is a word that we are using in Turkey all the time. We don't need to rediscover the USA. And this is creating a starting point for developing collaborative solutions that directly supports the public health. So what is the problem that we are trying to solve here? The problem is bioinformatics is powerful. We know that, we saw that, we are feeling it, but it's still fragmented. We had a lot of talks prior to my presentation. There are many pipelines out there. There are independent, some of them institutionalized, but there's an incompatibility problem in that, and some of them using different file formats. So reproducibility, scalability, and portability remain some of the major challenges we have. And we talked about the metadata, of course. We talked about the workforce, resource inequity, which creates barriers to adopt these strategies. Governance gaps, another topic, and the version control reduce sustainability of our resources. So what phage offers had been explained by Professor Allen. I'm not going to mention about that, but I will talk about what we offer to the community. So we are mostly focusing on the concepts that I mentioned, like interoperability, reproducibility, sustainability across different pipelines, right? So this includes the QC, metadata practice, versioning, open source, licensing, and strong documentation is one of the biggest impact. So the goal is simple. We are, of course, in an ideal world, trying to enable every laboratory, every institution to run reliable genomic analysis, and regardless of resources they have. And we're trying to do it with open, interoperable, and sustainable way. So how many people we have in our working group? We have more than 150 members, and we are thinking that we are one of the biggest working group at phage. I'm not sure about that. We can calculate that again. And great numbers come with great responsibilities, we know that. So how we do it? I would like to start with the brainstorm. We are having monthly meetings now in our working group. So with the members, we are gathering together and talking about the stuff that we are facing, some of the problems, and we are sharing ideas together, some inputs from the participants we have. Then we are collecting these ideas, and if anything comes up for us to go ahead, we are taking that idea and going to the next stage, which is research and data dump. So basically, we are going into the Google Drive, opening a folder, and putting everything in it, every evidence, every data sets, every paper, every information there. Then we are then shaping it to create a conceptual, finalized draft. So I'm talking about these things very fastly, but this is not happening at that fast. Then finally, after the finalizing the draft, we are going to the step that we are gathering some feedback from the community, which is we are trying to get in touch with the domain experts, some people that might be users of the solutions that we are trying to provide here. After we have done all of these, we are going into the field that we sharing this document, which is sometimes, I mean, most of the times happening as a guidance document. We share it in our GitHub page. So if anybody interested in, you can scan the QR code and go to the resources that we have so far. Also, we have the link. You can scan it, or otherwise you can find me somewhere during the conference, and I can guide you through that. So some of the things that had been done by the previous co-chairs of our working group, who is Kevin Lewitt and Jamie Southgate. They have done an amazing job, and they created some of the guidance documents for our working group, which are bioinformatics solutions for SARS-CoV-2 genomic analysis, QC solutions for SARS-CoV-2, identifying SARS-CoV-2 recombinants, and bioinformatics solutions for mpox genomics analysis. But what we have done after taking over in 2023, we started with different sub-working groups. So we have working group, the main one. Then we have sub-working groups are working on specific subjects, like wastewater. So wastewater is one of them. So Emily Smith and Josh Levy put a lot of effort into this and created wastewater surveillance guidance documents. It has strategies, data analysis, data sharing ethics and legalities, alongside with case studies. It's on the GitHub page, and you can take a look at that. And we have HIV bioinformatics solutions. These are the things that included in our guidance documents, from introduction to the case studies by Amy, Mark, Frank, and Abbas. We also have another one. These are the guidance documents that I'm talking about, by the way. That's another one. This is the 10 best practices for public health. So leading by Kevin again, by many others. I can't read all the names, but if you Google it, you will find it. The idea is to create some 10 some 10 best standardized approach to create bioinformatics pipelines and tools. So they came up with 10 simple ones, and this is from the publicly accessible repositories, being open science, open source license, common file formats, and testing, and reference data requirements, containerization, and workflow management systems are some of them. What else we had? We had influenza guidance documents, with the Emily again leading on that. We worked on the influenza guidance documents, starting from the genomic structure of the influenza to some of the training resources, again, case studies, and you may recognize that there's a pattern behind all of those guidance documents, which we, again, came up with. So, what else we have? These are the finished guidance documents we have, and we're still working on for others as well. So, tuberculosis, TB sub-working group, working on a guidance documents for TB. We have foodborne pathogen sub-working group working on the foodborne pathogens. We have phylogenetics one, and we have Oxford nanopore sub-working group. So these sub-working groups having separate meetings than the main one, and they are following the 5 steps that I explained previously. What else we do? We do knowledge sharing webinars. We had, especially this phylogenetic sub-working group lead this initiative. So we had introduction to phylogenetics. We had advanced phylogenetics with Zoe Dyson presenting. I think she's here. Also, Conor Meehan also gave us a presentation about tuberculosis. Kevin had a showcase of the best practices for pipelines, and we are aiming to continue with these webinars. So, you may think that we are bioinformatics pipelines and data visualization working group. Why not you're working on the pipelines, right? So, during the 2 years, we hadn't had a chance to work on the pipelines because it needs a lot of effort and a commitment from the community. But it doesn't mean that we are not going to do it. So we are, of course, after publishing our guidance documents as reference articles, we are trying to come up with maybe benchmarking data sets or benchmarking the common pipelines in the near future. And we are always open to suggestions, and I would like to encourage everybody who is interested to join to our working group as well. And I would like to finish my talk with empathy again. So empathy means to me sharing what you know and making it accessible in an equitable way. So always be mindful about accuracy, transparency, integrity of yourself, and technically create something usable. This is one of the things that we are trying to do in our working group, and make meaningful things for the community. And open source, of course, another thing that we are trying to achieve. And always there are constraints, challenges, but if we gather together, I think there's no challenge that we can overcome together. And thank you.